Melvin, could you hear me?
Yes, sir. Hello.
Hi. Could you hear me, Melvin?
Yeah, yes, sir. Yes, sir.
Yeah. Uh, Good morning, everyone, on this auspicious day of uh, observing the Suicidal Prevention Day across the globe is significant in its own way, and uh, it is good that most of the health personnel and the civil society organizations and mental health related organizations are coming forward and speaking openly about these thoughts. So I will not go into the minute details of it within a constraints of time and seeing the other speakers who have a lot of experience and telling from their uh, expertise. I'll fix only to the two of the just reflections what I read or what I think and how it could be and what are our roles that IAPH, what Anurika said as a member of a team, how we what could be done from our end maybe a small initiative could we take or could we do something. That's what my brief is today. So I welcome again on behalf of Innovative Alliance for Public Health. It's a group of volunteer nurses working nurses and students working across different sectors, and we do all volunteer work to improve the professional standards with that mode to improve the health status wherever it is. Let me say health status doesn't mean only individual level, institutional and societal level. So this society, you would have seen a lot of data on the suicidal, how many suicides occurred in country across the globe. Let me just brief you. It's the number of the suicides are very high and it's increasing. I will share you here on the link. There is a WHO's page where all these data are available. Fact sheet is just a 22 or 32 pages details. It's only about data. You can go through. Let's not pinpoint. Surprisingly, most of the uh, majority of the suicidal are among the males. Number one. Number two, majority of the around 70 to 80% of the suicidal deaths occur in lower and middle income countries. I'm speaking about larger data now, right now, including India, which is also a middle income country. Now, who are the people who are committing this suicide among the developing and non-developing countries? Important question. As you come to the developed country, the suicidal rates are high among the elderly people. As age grows, 70 plus, 80 plus, the uh, suicidal rates grow very high. Whereas in the developed country, the young population are committing this crime. So that is the one of the differences. Now, and having known that these are the major, some of the points to be noted. Now, why do they do that? What are the are there any changes occurring in your society that is rising the number of suicidal attempts or suicidal deaths in the countries? Is a question. So always I could see in the very simple sociological theoretical framework called as the causes for it and solution also in the same way. Individual level, institutional level, and societal level. There are changes. For example, I will give one example each three sections and I will pose a question and I will hand over to organizers. Individual level means as an individual Santosh, what are the changes happened within me? I am having thousands of friends on the social media, but I don't have anyone to speak with me right now. When I'm at distress, I'm in the stage of distress, whom should I believe? That's always a question mark. In the currently, it's called as you would have read a recently a paper called as info pandemic, where you have a lot of information, but which information is correct, which information is false, how to which perspective is the correct is a very difficult choice at the right in this time. Second is institutional. Institutional means not only the institute where you are studying or working. Institution means agencies, all the agencies, starting from family, friend circle, peer circles, your groups where you are located in. So all these institutions have been, there are a lot of modifications. Now everybody is, let me again come on the social media. There are many people on the different groups representing themselves to them. Do we know them closely? The question mark. One of the fundamental institutional structure was in lower and middle income countries of family. There's a disintegration of family. These larger families, joint families have disintegrated and came to the joint family. And there's also a new trend in the uh, lower and middle income countries. That is, we are approaching towards more uh, job oriented. We are more job oriented. Wanted to find some job away from our hometowns and going away from the family. It's a recent phenomenon. This internal migration or migration for the work. This makes you. This detaches from your parents or your family. There's a disintegration at the institutional level and societal level. I need not to tell you how does media plays a major role, and uh, everybody is depend upon digital. If I ask you how many of you read the book before you go to sleep, how many of you read a single page every day, except I'm not mentioning only for the your education purpose, non-education purpose. How many of you have a reading a habit of newspaper? So my societal level, what I want to say is there are many changes happened in the society, happening around our society. So those changes, for example, right now in India, there's a lot of media which is posing about every day you hear the political conflicts and how the political conflicts will impact you. I request on this platform to see the movie called as The Weller. It's an excellent movie, how it has been shown, how the society, your peer group completely influence your behavior and also changes automatically. You don't know how did you change. I won't take much of your time. What could be the uh, answers? How to solve this kind of issues? Again, it's the individual level. How do you build your habit? What do you want to do? What are your preferences in your life? Where do you want to put a uh, borderline saying that this is my uh, here I will stop it. This is my border. I cannot cross this. I am best only in doing this. These are my core competencies. When you identify, then that's a one way of doing it. Second is institutional level, like family, families, families, friend circles, institutions like your IAPH or Sukrut, or let's say national nurses scholar societies. They could also play some roles in that, and how intimately they will build the team or groups within the small groups to share their feelings or bring the people, those who have this feeling of, or you feel some major changes in them. That's the one. That's institutional level. Societal level could be it's very difficult to see the societal level changes, but could be done. When you represent, as Anurika boldly said, I'm very glad she was the one of the one who had undergone the suicidal attempt. It's very hard to people to speak about their societal actor. I had the suicidal EDA in my brain. I had that thought. How did I overcome that? When somebody could able to speak out their thoughts and tell open boldly, that's boldness is assertively said, I had this thought. It is not wrong having the thought, but wrong to commit that act. So here important is to come out and say how, what was the condition which made me to have that thought, and how did I overcome it. If we could able to share such type of stories to the uh, uh, different platforms, that could also help the those who have such kind of thoughts to change the society. That's a one way. And second, I'm telling the minimal ways which could be doable. There are many things which could be changed. Like, for example, ask me what are the societal changes you want to do, so do, Santosh. At the time, I say there should be a law, a policy where every person, doesn't matter who he is, in any cities, any citizen in any country, should be having a minimal minimum needs. That is, that's a famous movie you would have seen, a famous 90s and 80s. If you see the those times, it is called as Kapada, Kapada Ghar, uh, your food. We need our food, a shelter to stay, and something to do job. If these three things should be taken as a basic, and health as a fundamental right that could be included in our constitution, that will be great relief. Now, I will speak at societal level. Let us see about health itself. Health was a well, it's a responsibility of a state to provide the health care. If you see the health policies of recent health policy, which says that state is a health provisioning, not health state a health provider. So such kind of policy level changes when occur, how do you react individually and how do you react with your groups? That also plays a role. Okay. So with this, not extending too much, I stop here, and I again provoke you to think: did I Andrew did I any time thought of a this society? Did I had any suicidal thought? Number one, if yes, did I have someone to communicate? Yes, well and good. Did I communicate with them? And could I able to overcome that? And could I able to interpret and share that thought? Next, proceeding with, could I able to change such a, could I able to bring some of the changes in people among the people who have the such thoughts? What could be done? So with this, some of the questions, I thank Melvin, Mallikarjun, and Anurika, and whole Binu, Professor Binu, and all other people who joined hands together to make this happen, and uh, and could able to allow us to share my thought, uh, our thoughts. Thank you. Over to you, Melvin.
Thank you, sir. Uh, Anurika?
Yeah,
Yeah, proceed.
going ahead further. Um, Before going ahead, I would like to thank Santosh sir for completing so much in so less time and giving us so much in a very brief speech. Thank you so much again. And now we welcome Binu Jo, the founder, president of Nursing Scholar Society. We welcome you, sir. Please,
Yes,
Binu sir.
thank you, Anurika. Yes, am I audible? Thank you, Anurika, madam. Am I audible?
Yes, sir.
Yes, you are audible, sir.
Okay. So, namaste and warm greetings of the day. Respected Santosh sir, Mr. Nicholas sir, Dr. Prakash, Miss Gracie, Ms.Anurika, and dear Melvin sir. And of course, the backbone of the event, my dear colleague and a great friend, a great mentor, Mr. Mallikarjun sir. And dear delegates, warm good morning and warm namaste to one and all. Yes, each one's life is very, very precious. We are born in this beautiful world by the grace of someone or our own parents. So never decide or never think that you are alone in this life. It's together we can. And of course, together we can. But of course, at the same time, we need to accept the reality, yes, that society is increasing day by day, and the societal thoughts are also increasing day by day. We, as healthcare workers, part of healthcare team members, needs to educate the public. The public awareness campaign needs to be enhanced across the world and needs to communicate it that there is always someone for someone. There is always someone who is there for caring us or for loving us. They are not alone. We are all together. So we need to create a hope through the action and through our dedication and educate the public so that this societal thoughts and tendencies are decreases. Recently, I had an experience in my own college where I'm working. I'm working in a Christ College of Nursing. So recently, my dear one of the student, I will not name his name. So recently, my student, he has lost hope. He lost hope and decided to do the suicide. So that fateful day or that dreadful day, he came to the college. He was well. Yes, we were not aware he was going for that phase of life. But he came to the college. He went from the college to the home. By evening, what happened? His parents got alerted that he did not came to his house. They started ringing each one of us. I also got a call. Their classmates also got call. Everyone got call. We all started the mechanism of searching where he went. Now, luckily, these boys' classmates were very wonderful. They were angels. They were angels. I will tell. Really, they were angels. Within a short while, what plan they decided, they divided the work. One went to the police department for FIR. Some went to search his all the friends route. They started all the route map they did tracing. Some they connected with all their friends and their colleagues and all to trace the mobile. Luckily that his mobile was not switched off. So what happened? Early tracing was done and early management was done. Now the moral of the story, this incident was when he became normal, that boy, when he became normal, he was totally shell shocked. He was shocked that this much people are there for him. He was totally shocked. Oh my God, he was telling this much all people were there. He was really slowly when he was become normal. He starts telling us, sir, आप लोग सब है, आप लोग सब थे, मैं बच गया आप लोगों के लिए. So he was like that, but he had lost hope. Now today he is living very happily with all his friends. He is living for all of them. So that is what I want to tell. Really, we need to communicate the public that there is not alone. We are all there to everyone. So there is no one is alone. There is always someone for someone. So you are not alone. All of you are with. So be strong. We need to create hope with our own action that people are not alone. There is always someone who cares for you, loves you, and always there is a ray of hope everywhere. So all the delegates, I will only communicate that be strong. We all are there. Everyone is there for everyone. So we need to create hope, instill hope. A dose or a booster dose of hope is always needs to be given. No one is alone. It's together we can. With these few words, thank you for all the delegates and all the organizers for inviting me for such a wonderful platform. Thank you all. Thank you.
Thank you so much, sir. It was very enlightening. And now moving further, before we move further, I just want to put in something that it came as a shocker to me that National Crime Record Bureau has reported that in 2020, students took their life every 42 minutes. That is 34 students committed suicide every day. Uh, that came as a shocker to me when I gone through all this data. Now, um, moving ahead, we have our next guest who will be speaking on global magnitude of suicide, Mr. Nicholas. And to brief him about his Nicholas sir is assistant professor, Department of Mental Health Nursing. He has completed his UG and PG in Sri Ramachandra University. He has done clinical psychology, worked as clinical psychologist in CMC Vellore, has published many scientific articles and presented papers. So we will be enriched with his lot many experience, and hopefully we'll learn a lot. Welcome you, sir. Nicholas, sir.
A very good morning to everyone, and thank you, ma'am, for addressing me. And before anything, I would welcome you all for this platform of the National Suicidal Prevention Day. And I'm really glad to share my few thoughts and certain informations as one of the psychologists and in the Department of Psychiatry. Well, as I get into the topic, before I start, I really thank you, sir, Mr. Santosh, sir, the research coordinator. That was a really an important thought which was given to us. And sir, we will now really check out the movie as you told, and hope we will also learn certain things in regarding to the suicide, and especially our one of our sir guest speaker, sir Mr. Binu Joe, the founder of and the president of NSS. Sir, really that was informative. And yes, sir, in regarding to the students, that really plays a very very vital role in checking after. And the example which you told also, sir, like in which the students played the smart role, that was really impressive. And we also learned certain things where we can get on to us, like when we teach and get to the students, like we don't just focus on the educational background or just on the educational view, but we will also look into the universal concept where we will also make the students to get in a better way where they can look after that apart from the boundary line of the educational point of view, especially. And madam, that was another statistics which really helped me, madam, like in where you told around 34 students have been getting attempted to student suicide, which is very unfortunate. But and this tells us like how much we have to focus and like make on to or look into it and work through the process in where we have to focus on the students, as really they are known to be the adolescents, where we have to look into where their brain is actually not getting matured more, and still they have more time where, but still they get into the decision making as early in process. Well, with this information, say thank you. And now I get into the topic, the global magnitude, which was given to me. And once again, thank you. Well, as we start this topic, I'm introducing myself. I'm Mr. Nicholas from the PS College of Nursing, working as an assistant professor, AP. Well, so before that, like as we see the suicide prevention, Well, we know there are so many types of psychiatric emergencies where we have so many emergencies in which we see like the cardiac stroke is one of the psychiatric, which is generally known to be an emergency, or the neurological conditions in which RTA gets on. Like that's about one of the emergency. Well, but when we get into the psychiatric session or to the psychiatric setup, we generally focus on like one particular factor which is known to be a major and a major leading cause, which is known to be the one of the psychiatric emergency, which is called as the suicide. Yes, okay, as the word itself is known to be quite hard in session to understand. Well, suicide is known to be one of the leading of the psychiatric emergencies in which it is generally focusing on the mental status in ending up with your physical disaster. So this is about this is about known to be the psychiatric emergency in which the suicide has to be focused upon. Getting into the topic or to the theme of 2022, according to our social prevention theme, it's about creating hope and through action. Yes, as our respective sir, President sir of NSS told, it plays a very vital role on in creating the hope through the action. Unless and until we don't have the hope for looking in forward, or unless and until we don't have the future existent to look into the work through the action, we will not be focusing on to the working process, which is generally referred to as through action. So creating hope is playing a vital role in prevention of suicide by an effective nature or inefficient way of action to it. With this introduction, let me get into the topic. So as we get into the global magnitude of suicide, generally suicide is known to be where when people harm themselves in which the goal or they will get into the goal of ending their lives as they die as a result. So this is not generally which they focus on getting to the physical disaster first of all, in which it happens for the other systems like your respiratory or like any other cardiac systems. But when we get on to the suicide first focuses on the mental status, or it just focuses on the psychological condition of an individual. So this is known to be where we have a very vital role in improving the coping strategies of an individual, or making the individual to be in a better, more in a confident level, or making the individual to have a better, more in a self-esteem, in which they will have the goal in a different view and not in ending up with some unfortunate condition called as like ending up their life. So this is where it goes on, where people harm themselves with the goal of ending their life. Well, as we get on to the statistic, every year around 7.03 lakh of people take their own life, and there are many more people who are attempting suicide. So this is about where people are been taking about like their own life to point, I mean 7.03 lakh. So getting more in detail, suicide occurs throughout the lifespan. So this is where we don't have a boundary section of the age factor, or we don't have this particular age group which is known to be the risky in factor, or we don't have any period like adolescents are more prone, or the elderly people are more prone, or like the adults are more prone. So this generally starts up with like throughout the lifespan, but it is commonly where 15 to 29 years of old people are known to be like quite more in condition where they are leading cause of the death in regarding to the suicide. And over 77 percentage of global suicides occur in low and as well as in the middle income countries. So this leading about the regions and the countries, we will look into more in detail as we follow it. So these are the general information which has been given by our WHO. And next one, getting on to the global magnitude of suicide in more detail. Suicide generally remains like one of the leading cause of the death worldwide, which is like a common statistics, or which is known to be the common scenario or the phenomena which leads up for the years and years or the decades together. So it is known to be one of the leading cause on the worldwide, and every year more people die as a result of suicide than the vulnerable, or like than the heavy conditions like the HIV, malaria, or even the breast cancer, which is a very common cause of death. So this suicide is known to be like very or the leading cause in compared to the other disease conditions, where one in every 100 death in people, or one in 100, they are more prone of committing suicide, where as we all know, like no, males are more common than the females, where 12.6 1 lakh people of the males are compared, when like only about 5.4 people or 5.4 of the females were compared to the male of 12.6 among the same of 1 lakh in scenario. Of course, this is also not the right one, but which is happening, but still we have to focus on where the males are getting more prone of getting or attempting the suicide, leading to death. And getting more, like suicide rates among men are generally higher in high income countries, where 16.5 per 1 lakh is being caused or an attempting death. And in lower middle income, as we saw the previous slide, lower middle income countries, the attempt suicide rate are higher among females, where 7.1 per 1 lakh in regarding to 1 lakh people of attempting suicide. And so here we can see about the suicidal rate of 1 lakh people, which is given by the WHO again. So as we see here, the regions are being classified, and we can see the first bar diagram, which tells us about the global scenario. So in regarding to the suicidal rate for 1 lakh people, the globally it's around 9.0 is known in a global wise, where in regarding to the region session, where Southeast Asia is around carrying about 10.2, and European countries it goes around 10.5, the African countries again with 11.5, which goes on with the leading session, and finally the in regarding to Eastern Mediterranean it's around 6.4 rate in regarding or compared to 1 lakh people. So this is about the suicidal rate, which is being classified in a global way and as well as in the region session by the respective World Health Organization. Okay, now let's get into our Indian statistics. Well, suicide is a personal tragedy that prematurely takes the life of an individual and has a continuing ripple effect, affecting the lives of the families, friends, and communities. Again, as our former sirs they told, like it includes like general the families, the friends, and even the society or the community which has been surrounding. Well, when the individual like they attempt to attempt suicide, or sometimes when they attempt suicide, and sometimes when they that ends up in leading their life, it is not only the big guys or the victim is being affected, but it also includes the families around and the friends as well as the communities where they are also been generally affected. So every year, more than 1 lakh people commit suicide in our country, which is generally known to be the rate of 11.3 per lakh of the population. And the rate of suicide has increased day by day or by decade, I mean, in by year, about like 8.7 in percentage during the year of 2020. The family problems and illness were the major cause of the suicide, which accounted of 33.6 percentage and 18 percentage of total suicides respectively. Of course, there are many more factors, or of course, there are many more reasons for attempting suicide. But as of course we'll see in the following slides, but these are known to be the common or the leading cause of the attempting suicide. Two general factors. One is the family problems and the sickness or the illness when we compare accordingly. Here we'll get into the suicidal rate again in regarding to the trends of India, or we just focusing now, we'll getting on to the Indian session, the same around the suicidal rate for 1 lakh people. So here we have been classified into 5 general years, that's about from 2016 to 2020. So 2016 is about like 10.3, and 2017, well, we're happy that it decreased, well, 9.9. Again, 2018, unfortunately, it started going up, well, from 9.9 to 10.2, and 2019 again, it's around 10.4. But now the recent strategy which has been telling us, like in 2020, it has been very gradually increased. That's around the 11.3. So now we can see like it's around like 2020, it is 11.3, which is more increased when compared to the other previous years. And of course, like unfortunately, like it would have been increased like now when we check onto the status of 2022. So well, this is about the trends in India according to the suicidal rate of 1 lakh people. So now we'll get on to the proper statistics in which we have been focusing on to the state-wise percentage of the suicidal death. So according to the state-wise percentage, here I'm just focusing on the general six state-wise which states which has been focused as they are playing a very vital role. The first one is both the Maharashtra, Tamil Nadu, and third Madhya Pradesh and WB West Bengal, Karnataka, and the other states. So in regarding to that, and of course the other states which includes globally where it includes the common other states apart from these conditions where the Maharashtra is known to be the leading cause, which stands for around 13 percentage, and Tamil Nadu it's only, and of course not only, sorry, it's around like 11 percentage, and MP Madhya Pradesh for around 9.5, and in regarding to the West Bengal, it's around 8.6 percentage, and Karnataka carries off the 8 percentage, where the other states, which includes other than these kind of states, it includes the carry of around 49.9 percentage of the suicidal death to the percentage status. So this is about the standard, or this is about the scenario in regarding to the Indian statistics. Well, now we'll get on to these states which is having the higher suicidal rate. So here again with the suicidal rate per 1 lakh population, here again I've been classified based on the conditions. Like one is about the ANN, the Andaman and Nicobar Islands, Sikkim, Chhattisgarh, Puducherry, Kerala, Tamil Nadu, Telangana, Tripura, Goa, and Karnataka. So, in regarding to that, the rates of that, the previous one we had the discussion about the percentage level, where this is about the suicidal rate around like 1 lakh population. So, around see, we can have the picture is telling that like Andaman and Nicobar Islands carry out around 45.0, and Sikkim it's around 22.5. Chhattisgarh carries of 26.4, Puducherry of 26.3, Kerala is around 24.0, Tamil Nadu carries around 22.2, Telangana 21.5, Tripura is around 20.09, Goa carries of 19.9, and Karnataka carries about the 18.4 in condition. So this is about the Indian statistics again, telling us about the states which is having the higher suicidal rate, where Andaman and Nicobar Islands stands first in getting to 45.0. Well, now we'll see about the leading cause of the suicidal death in India. So, in regard to the leading cause of the suicidal death in India, as we saw already in our introduction session, the family problems and the illness are playing the very vital role. No, like, well, the family problems carry off from 33.6 in percentage, and the illness or the sickness carries around 18 percentage. So these are known to be the major conditions or the major categories which are playing the vital and a very important role which is leading for the suicidal death. Yes, even our sir, when sir gave an introduction, Santosh sir, yes, sir told us suicidals are known to be the major conditions in which the families are being broken up, or the broken families are also known to be like one of the major causes of causing our attempting suicide. That's around like 33.6. Well, as we see about the other causes, well, poverty, it stands for around 1.2 percentage. The professional career, this goes around or the problems in the professional sessions is around like 1.2. Failures in examination, the common scenario is about 1.4. Unemployment goes for 2.3 in percentage, and the bankruptcy it's around like 3.4. The love affairs, no, like it is also like carrying about the 4.4 percentage, which is not so easy. Like when we compare or the previous, as we saw, the unemployment or the failure examination or the professional or even the poverty, these are not coming to this scenario. So this is where most of us, as we had a discussion in the middle of this, I mean, in the beginning of the session, where we have to focus on the students, where they also come under this categories of the love affairs, which do for 4.4 in percentage, and marriage related problems are around 5.0 percentage. The drug abuse, the it's around 6.0. So this is also which is like gradually increasing day by day, where the individual, I mean, where the before, like we can see the adults, they were being focused on, or they are being most abused with this drug abuse. But now the scenario or the strategy is totally different, where even the adolescents are being focused upon this kinds of use of the drugs, in which it has been increasing gradually. So we have to have generally, now we have to focus on these conditions also in the drug abuse of like 6.0, and some of the causes which are not known is about the common factor, where it stands for the 10.0 in percentage, and the other causes of like 13.1 in percentage. So these are about the leading causes of suicidal death in India, in which it goes on. So when a small point added to this drug abuse is like when I was working in the Christian Medical College, like we have a separate session for this drug abuse, focusing on like we will be taking a certain statistics, or we'll be just doing a certain stats based on that particular areas in which they have been using more drugs. And we will sometimes focus on the health education, creating the awareness, and we'll make up the small research stats in which that will help us to know and help us to focus on to the further steps in which we can help up in reducing the drug abuse. So it's about the one of the factor we really have to focus on, the leading the one of the factor of the drug abuse, in which it also doesn't have the age factor, of course not with the primary session, but starts from the adolescent. Now it's getting more increased from the adolescent, adults, and even to the older and to the elderly people. Well, this is about the leading cause of the suicidal death. In forward to that, this is the now we'll have a small discussion in regarding to the educational status. So this is educational status in which it is being focused upon the suicidal death again. So when we check on to this here, the secondary level and the middle level plays a very vital role. Well, the secondary level is known to be where they're getting around 23.4 in percentage, and in checking on to the middle level of the education, they are getting on with 19.4, I mean 19.5 in the percentage. Of course, like when you get on to that higher secondary level into that, like it's around like 15.9 percentage. And going on to the primary level, they also have the contribution where 15.8 of the percentage are been attempting to the suicidal death. Sorry, not attempting, but they are like ending up their life with the suicidal death. So this secondary level and the middle level is being known to be the primary factor or the major factor in which it has been caused up. So that's what, as we had a discussion earlier, this level of students or this age group of people, they have not matured in their brain session, or they are not fully matured, but still, and that is where they think that this is known to be the option. And sometimes they think like we have no more hopes, or sometimes we'll think that we have no more session to play in our life, and finally they go and end up with this condition. See, I have one small example. Like now when I was again working in CMC, or like in that we will see some of the burns conditions or the individuals coming. So I see like some of the people around the school people, the students, when they come in such conditions, when we have the chance of talking to them, like after they get a better more status, where we have a conversation session. So when I do go, or when we go do ask them, why did you do this? And they will tell, sir, I also don't know why I did this. That was just a cracked in a situation in which they will be getting onto that particular trap, where they don't know how to reduce their stress level. Now they don't think like what is their coping styles, or they don't think like what or how they can solve the problems. So they are, we also have, or we have a certain things in which you have to focus on, like reducing the stress level or improving coping strategies, helping the students in small of the problem solving techniques, or teaching the students in the small of the problem solving techniques, like a critic thinking will also really help them, or help them, which really focuses on the diversional therapy. So not more in detail about the therapies, like basic things we can also focus on this primary education level, or in the secondary or the middle level, or even the higher secondary level, in which this is also playing a very vital role in the suicidal death. Well, adding more to that, like graduates, or they contribute on 4.0, the diploma people of around 1.3, professionals go around 0.3, and status which is not known goes around with 7.2 in percentage. So this is about the suicidal death in the educational status in regarding to the Indian stats. And next we'll see about the age-wise crew death rate in India. So when we have the age-wise crew, this bar tag or this picture tells us a clear picture like which is having the higher rate of the suicidal death or the death rate. So we'll start with 15.4, I mean sorry, 15 to 24, 25 to 34, and again 35 to 45, 45 to 54, 55 to 64 to 85 plus, in which the 85 plus or more than 85 years of individuals have been causing or they are known to be the leading death for the in regarding to the crew death. So that's around like 57.15, where 17 to I mean 75 to 84 of percentage, that's around like 27.48, and again like 65 to 74, it's around 17.45. So and of course the previous to that is around 55 to 64 goes with 16 to 20 16.26. So when we have a small like attention to this, like this is around where the individuals are known to be in a geriatric or like improving, I mean like more of the geriatric or starts with. So what happens, like this is where again as a theme tells us like create hope. So here is the categories where the people or the victims of this category are loosening of their hope, and they are tend to have no hope in their life, or people they don't know where to march accordingly, or they don't know what is the destiny of that. Sometimes of course like people are being left alone from their session due to some social crisis or due to the family issues. Again, as we saw in the previous thing, like family problems are known to be the leading cause. So this is where is known to be like giving us one of the picturization like this geriatric is being focused on. So here we also have a very vital role to look into the old age session, where that is where like we also have the general stats, or when we check on to that, now the old age homes are being quite increased, or now the old age homes are being improved, I mean sorry, are getting more in condition, and people in the beginning and all, even the old age homes were there, the clients were less, the victims were less, whereas now it is getting more and more and more increase, and that is how it goes on. So we have a very vital role in which we have to focus on this old age victims also, in which we have a very much role to focus on, again improving their coping life and showing their better way to, or the showing making a way path to them where they can lead on to their life, where in reducing the crew death to that. Well, in getting to more in detail, like 15 to 24, it's around 13.77, where 25 to 834 of years, like they carry around 18.56, and 35 to 44, it's around 18.08. So here we also see like 35 or even 25 is known to be where the this is around the group again where they involved into the family crisis again, and 45 to 54, it's around 16.87. So this is around, this is known to be the rate or to the condition in again compared to the 1 lakh population of the death rate. Well, so this again with the Indian statistics. So we'll just have a small outlook which are known to be the major risk factors in attempting suicide. So as we see again, like first one as always goes with the depression, or the individuals who are in very depressed conditions, who are getting on with the grief again, and some substance abuse, relationship breakup, conflict in which they end up with small confusions with no clear mission, and then getting on with the disasters and the violence, the abuse. Apart from the substance abuse, we have so many abuse in again, and the loss and sense of isolation, financial crisis and the poverty, and the professional career problems, failure in examination, marriage related issues, and the family problems as common. A small attention kindly again for the abuse. Apart from the substance abuse, we have and the other more varieties, or we have the other more abuses which we have to focus on. Sexual abuse, this is again which is increasing day by day. Like that is where now we are starting up with the educational like awareness. Like we go to again, when I was when we were working in CMC, like we used to go school, every school, government school especially, will teach them what is good and bad touch, will tell them how to solve the problems, or will make them what is the abuse, or will help them to know what is the abuse. And that is where it really helps us. And of course, when we get on to that, we also have the personal counseling session in which we will also get some information like what is the scenario or the stats to it. So this abuse has been telling us the clear factor, like these are also known to be one of the risk of causing suicide. And now as we all come across the days are getting more and more focus, or days are getting more and more in conditions to this abuse focusing on. See, well, now, been checking on to the previous or before decades, or like even 5 years before, and now when we go down to the 5 years after that, now we can have a small and you can have a gradual increase in the abuse states. Like even now, sorry to say, like sometimes even the 6 months of the kid, starting from the 6 months of the kid, and sometimes even to their relatives, and they are getting into in this abuse conditions, in which we as a psychiatrist or we as a nurses, we play a very very vital role in teaching them first of all what is abuse, in giving them better more health like education in regard to this particular factor. So these are the general risk of suicide, in which it is known to be the common factors causing on to the leading of death. So in regarding, apart from that, we have been focusing on the vulnerable groups. First one, as we see, that's about the refugees. That's about the first and the most vulnerable group of the suicidal death. Second, migrants, the indigenous group, the lesbian also, and the gay people of who come under this category, bisexual people, transgenders, and even the prisoners also come under this vulnerable groups of attempting suicide. And apart from that, we also have getting into the conclusion, like suicide is known to be the major social crisis across the globe, in which of course that helps us, that leads in state of the disequilibrium of the individual's life. And suicide rate keeps increasing gradually, as we saw from the previous and to the present status. And causes of the suicide are very and very wide, and majority are unknown, and it needs to be considered and act immediately to prevent them. And we have a very important session, and the kind steps to be taken accordingly to that. And all the health professionals holds the responsibility to identify, help, and educate the persons who are under this suicidal risk especially. And of course, it's the right time to enhance knowledge on the suicidal prevention and unite together to reduce the incident rate as well. Now, so a small information is like this is the helpline and the free counseling session, or the free counseling information which I can tell you. Like in all India, I call helpline is this is known to be, this is the number in which it happens for the all over India, where plus 9091529878 and 21. And this is a small QR code in which if you can scan it up, this gets up with this state-wise helpline, and this helps you for the further counseling and helping us or helping the victims also to stable themselves and maintain their equilibrium as well. So these are the small helpline groups which is making us and helping us to get forward to it. And a small take home message. So let's again hurdle up together, stand together, act upon, and prevent suicide. So this is about a small take home message. And with this, I conclude my speech. And once again, I really thank you for giving me this beautiful opportunity to share a few words regarding the suicidal prevention and the magnitudes of the suicide. And I also thank Mr. Melvin David for the organizer of this program. It is really working up, and hope your lending of hands will really help us to get more in forward. And thank you once again, and thank you all participants. Thank you.
Thank you, Nicholas sir. Anurika?
Yes, I'm taking over. Thank you, Nicholas sir. And those data were bone chilling, and we got to know so much of suicides are happening around, and the vulnerable groups, and yes, that shows who are our target people, means to whom and who people really need our help. And coming on to the nursing role, as we all are here as nurses.
Anurika,
Now,
sorry for the
the next topic will be the same: nurses' role and policies on prevention of suicide. As we got to know what are our target groups, we would like to invite Dr. P. Prakash, Assistant Professor, Department of Nursing, College of Applied Medical Sciences, Prince Saitim bin Abdulaziz University, Saudi Arabia. We welcome you, sir. And going through about the credential of sir, that will be just picking up few feathers from the cap. So I can just briefly tell you about sir. Sir has done professional training in government hospital, Kanchipuram and Madras Medical College. And he has done his medical surgical nursing, child health nursing, and OBS also. Professional training program. Government Hospital Coimbatore, National Institute of Mental Health, that's NIMANS, for mental health nursing. Research project of MSc nursing was conducted at Krishna Nursing Home. And I'll start reading everything about sir. It will be the end of day. And sir, we will be really looking forward to enrich ourselves with your commendable role in nursing and your learning. So let us have all the juice sir can give us for today's this webinar. We welcome you, sir. Over to you. Talking on nurses' role in policy on prevention of suicide. Dr. P. Prakash, sir.
Yes. Yes, is my voice is audible to you all?
Yes, sir.
Yeah. Okay. I would like to know, is my slide is visible to you? Is my slide is visible to the
yes, sir.
participants?
Yes, sir.
Yeah.
Yes, sir.
Thank you, thank you, thank you very much. Yeah. So, okay. So, yeah, warm good morning to you all. And on this auspicious day, I have got an opportunity to talk to you about the nurses' roles and the policies in the prevention of suicide. So before the session, I would like to thank Mr. Binu Joe and as a president of the founder and the president of Nurses Scholars Society, and Mr. Melvin David, the organizing secretary of the entire program. So the suicide is why we want to have celebrate a particular day and particular week, because the suicide has been booming up, and this is a booming issue. And the suicidal thoughts has been rising out of one's mind, like we can quit the life, we can end the life. So that is so sad, because there are one particular group of people who really wants to thrive for their life, and there are a group of people who want to quit their life. So it is in the two extent, and in a prism, it's a two extent of phenomena we have to address, like why they want to end up the life, and what is going to be the root cause for it, and how come we can help them in some way, that we can help them to come out of these suicidal ideations and thoughts. So we all know very well, creating hope through action is a theme of this particular year. The self-esteem plays a very vital role. The self-esteem and the self-confidence will always plays a very, very vital role an individual to come out of a suicide. So that's the reason that we had a theme of this particular year on Suicidal Prevention Day. And so its suicide is nothing but it is a psychiatric emergency. What is a psychiatric emergency? So psychiatric emergency is an acute disturbance of a behavior, thought, or mood of a patient that negatively impacts a patient's ability to function in his or her environment. So when there is a negative impact, then automatically there is a disturbances arises in one's own behavior, thoughts, and mood. So we need to create this negative impact into convert it into a positive impact. So when you do that, when you try to do that, when you build up that, when you can help the patients who have a suicidal ideation, it must be treated properly. Otherwise, the individual may harm oneself, and even the psychiatric emergencies not only harming self, but also they used to harm others too. So we have lots of psychiatric emergencies as it starts from suicidal attempts, catatonic stupor, grief, transient situational disturbances, epileptic furor, and drug-induced or withdrawal syndrome, delirium tremors, hysterical attacks, serotonin syndrome, overdose of the psychotropic drugs, extrapyramidal symptoms, rape victims, and the panic attacks and the victims of disaster. So we have lots of psychiatric emergencies. In these psychiatric emergencies, we know very well this is the most common thing is the suicide and attempted suicide or completed suicide. So this is a very most common issue in a psychiatric emergency that can be easily prevented. So why you are talking this much about the suicide, you can prevent. It is in the hands of an individual, and it is in the hands of the person around the person who is been having the suicidal ideation. So the term suicide, it came from the Latin word suicidium. It means killing oneself. The prefix su denotes oneself, and sidium is killing. So what it actually defines, the term defines is, it is the intention to kill oneself or self-inflicted cessation of life, which ends in fatal outcome. So the individual has an idea to attempt a suicide or complete a suicide is or complete or kill oneself is that means a suicide. Okay, so when you ask someone like which is going to be the enjoyable moments or a joyful thing in your life, automatically everyone will share it is nothing but it's going to be my college life, right? But the statistics, as Mr. Nicholas has projected a lot of magnitude and statistics in regard to the mental health issues and suicidal attempts, the suicidal thoughts is booming among college students. It is the issue that we just want to turn back and see how come the joyful days are booming up into the suicidal thoughts of college students. What is the issue, and how can we can rectify that, and we can help them, the next generation persons are attempting suicide. So it is very vital and important to help them to come out of the suicidal thoughts. There are mental health matters a lot. Even though we can see when we draw a graph, we can able to identify nearly 15%, 52% of the rise in the suicidal rates has been increased from the previous years to present. There are a variety of reasons behind it. So why it has been increasing and why it is there, because the research has revealed that the students are suffering out of depression and anxiety. This is because of zero communication which they had with the parents. They are more dependent on gadgets, or there will be a mollycoddling, that's the child is overprotected by the parents. There is an instant sense of gratification. that if something is required, they need it now. They are not practicing any delayed gratification. So these all really put the students into a state of the less frustration tolerance. They are unable to tolerate any sort of frustration nowadays. So that is a very pathetic issue. So that has to be addressed, that has to be taken care by all the health professionals, so that we can have to save the life of the future generation. So suicidal and self-injurious behaviors among among the students in 2020, it is taken up from the Healthy Minds networks. You can say that nearly 13% is having a thoughts about a suicide, and 6% has a suicidal plan, how to execute the suicide, and 1% was attempted suicide, and 23% was purposefully injured themselves. See, 23% is nearly, if you divide it, it's a very, very huge amount of percentage that how they are in a harm, inflicting the harm on oneself. So it is a very major issue that has to be rectified and addressed. So let's come to the point. What is the role of the nurses? What is the nurse's responsibility? How come we can prevent the suicide? What a nurse has to do and what a nurse should not do. As a nurse, we can closely monitor the patients. It's not only a patients, if you may be a student, or when you have some suicidal related clues, when you have some warning signs. We are going to see what are the warning signs of suicide in forthcoming slides. So if you identify any sort of warning sign in an individual, you need to closely monitor them and don't leave them alone. When you identify when there is a warning sign, you don't leave them alone, because if you are leaving them alone, is automatically due to the suicidal thoughts, they may attempt the suicide. And you can accompany the patients wherever he or she goes. Do not allow the patients to lock inside the bathroom, right? So because that creates them the pathway to attempt suicide. And avoid keeping the dangerous objects near to the patients or to an individuals, because that provoke the tendency. So I have this, so I can attempt suicide using this particular instruments. So don't keep the ties, belt, sharp instruments, shoelaces, long towels near to the patients. These are the different ways, that pathways that they think of suicide. They automatically, the next thought is going to be how I can attempt the suicide. So they will search for the objects which it can attempt suicide. So don't keep those objects near to them. Sedate the patient if a patient is not controllable. Do not scold the patient in front of others, even not only the patients, even it is the major psychological trauma. Even the college students has that the professor has scolded me in front of all. That creates them a lot of psychological trauma in them. So do not scold anyone. When you want to appreciate, you do appreciation with the group of people. But when you want to scold them, when you want to identify, when you want to point out some mistakes in an individual, keep them to be separate. So ensure them they are separate, not in the group. And teach the family members or the caregivers that the patient need to be monitored continuously due to the increased suicidal risk. Do not allow the patient to take the medicine by self. That they take the medicine, they take a lot of amount of medicines, especially in psychiatric setups. They took lots of medications, but those medications will really harm them or put them in suicide. Encourage the patients to verbalize his or her thoughts related to the suicide, right? Yeah. So any individual who having a suicidal thoughts or ideation, talk to them. Okay, when you talk to them, when you verbalize them, then the issue is addressed. Instead of keeping them on hold, the depressive ideas is going to bloom up. It is a bottled up emotions. The bottled up negative emotions will provoke them to attempt the suicide. So in order to prevent that, encourage the individual to verbalize what is their thoughts related to the suicides, and never keep any syringes or needles in the patient's room, and you apply the restraints if necessary. See, when you realize that patient is going to harm himself or going to harm others, then that is the time that restraints is necessary. Either it may be a physical or chemical restraints, because you have to save a patient, save the individual at that time. And do not keep anything in the drug cupboards with which is very reachable to the patients. And what are the warning signs of suicide? So, when an individual has the suicidal ideations or the suicidal thoughts, what's really warn us? We have to be very cautious. We need to monitor them. What are those particular signs? We can address this in terms of action, words, and emotions. And what sort of actions the individual perform is nothing but the individual may have the influences of substance abuse or other self-destructive behaviors. There are evidence of the previous suicidal attempts, like when they have a history of doing once, twice, thrice, they become expertise in doing the same, right? So when there is a previous suicidal attempts, so that is a warning sign for us. And withdrawal from the friends, family members, and the beloved ones, when they are lonely, they are at high risk, because when they are united, they can able to share their feelings, they can able to ventilate their feelings. When the individuals are lonely or alone, it creates a platform of rising up more suicidal thoughts. And giving away all the possessions, right? Okay, giving about the assets, giving about the money, these sort of behavior we denounce that, okay, that individual may attempt suicide. So these are the actions that we can analyze as a warning sign. And what sort of words you can analyze the individual or at the suicidal risk is talking about the death or suicide. Uh, they keep on, they say like, I want to die. What is the use of living? Some sort of phrases which denoting the death or denoting the suicide is a warning sign. Expressing the hopelessness when talking about the future, when the individual is hopeless, helpless, worthless, when they feel, that is what this year theme that we are addressing about, creating hope. Okay, when they have a confidence, when they have a hope about the future, when they have a hope about the next step in the life, then automatically the individual will have a good psychological health, right? So when the individual express hopelessness, it is a warning sign. And saying goodbye, okay, bye, we cannot see you if you in future. So these sort of words, it creates a warning sign. And what sort of emotions the individual may have: anger about the anger shown on others, or the individual may be anxious. There are noticeable mood changes. Suddenly they become more happy, and suddenly they become too much depressed. The tendency of bipolar is it's again provoke us, the individual may attempt suicide. And unexplained calmness after displaying all the above characteristics, they be alone, they be lonely, and they are very calm. Okay, not talking anything to others. That is also a warning sign. So we can address the actions, the words, and the emotions, what the individual express in terms of it. So that is a warning sign of a suicide. We need to monitor the patients or the individuals on a regular basis. And we have a lot of standard tools to address the suicidal risk, to determine the suicidal risk. It is very important to determine the suicidal risk, then only we can able to monitor them, we can prevent them. Without doing an assessment, we cannot prevent them. So who are under the major risk? We have a sad person's scale. It is a famous tool that we commonly use for the addressing the suicidal risk determination, right? So we have a mnemonic for it to remember: for S for the sex, and A for the age, D for the depression, and P for the previous attempts, and E for excessive use of alcohol, or for rational thinking loss, and S denotes separated, O for organized or a serious attempt, and N denotes a no social support, and S for stated the future intent. And when we describe each factor and give the points of it, the male or a generally a higher risk of attempting a suicide. The completed suicide risk were higher in the male when compared to that of female. This based on, we give points based on the risk. It does not mean that the females will not attempt suicide, females will not complete the suicide. Females are also at the risk, but the more risk was on males, because females maximum they attempt suicide. It is threatening behavior, they want to threaten them. For that purpose they try to attempt suicide, but not focus on the completed suicide. Okay, right. So the male are at the higher risk, and the age group or in a teenage, and the age group above 45 years of old, when they are starting up the period of the elders, are at the higher risk. When the individual attempts to depressed or decreased concentration, appetite, sleep, or libido, then they are at a higher risk. When there is a previous attempt, again, it's high risk. When the individual has a chronic addiction towards alcohol, it's again a high risk. The individual is having diagnosed with the psychosis or organic brain syndrome, then the individual is also at high risk. When the individual is separated, but they are on their recent or on anniversary, that really provoke their previous life, how they enjoyed, but what they are really missing now. Okay, so that those sort of thoughts will also provoke them suicide. And when there is a well thought out plan or the life of threatening presentation, okay, when they have a very serious attempt organized plan, that is also had a higher risk of suicide. When there is a no close family, friends, or job, or active religious affiliation, also at higher risk. When it is determined to repeat the attempt, and or the individual is very ambivalent, so that is also at higher risk. So from this we can determine the suicidal risk when they are below 6 or at the lower risk category. When they are at falls in the 6 to 8 is intermediate, and above 8 is when they are at higher risk of attempting suicide. So how we can prevent the suicide? We can prevent the suicides. We can categorize as a primary, secondary, and tertiary prevention. So what we have to do primarily, that is the firstly, what we can do at the first moment is enhance the skills of the health team members to identify the risk factors. All the health team members has to have idea to see who are at higher risk, who are at the lower risk. They need to differentiate the individuals. They need to differentiate this. Those differentiation, the health team, the knowledge that the health team members will have is able to identify who are at the higher risk. So they need to monitor the individuals or the patients who are at a most risk. Then refer the high risk individuals. When you identify the individual is a high risk of attempting suicide, when you are able to see the warning signs, then immediately the nurse's role is going to refer them in towards the appropriate intervention, because that will help the individual a lot. And do not allow the individuals who are having a suicidal risk to be alone. Don't make them to be alone. They have to be in a group. So that will divert them, that will divert their suicidal ideations of thought. And identify the stressor. Because see, unless we are not treating the root cause, we are just talking about the suicide or making them divert is not a permanent solution. See, that's a temporary solution, because again they are going to have a suicidal thoughts, again they're going to attempt the suicide in future. So we need to treat or address the root cause. What is the problem? Okay, is it the economical problem, or it is a perceived stress, or the individual have a low frustration tolerance? So what is the real causative factors? It's the individual provoke the individual for the suicidal attempts. We need to address it. And as a nurse, we have to conduct a lot of crisis intervention program. At the same time, we are have to restrict the means of things which is easily accessible to the patients or to the individuals, because when you keep the poisonous materials near to the person who have suicidal thoughts, the individual is easily accessible to take the poison and consume it, right? So those short instruments or poisonous material should not be in around the individuals who have the suicidal ideations or the thoughts. And what we focus on the secondary prevention, we do provide them a guidance on a counseling services. It's a very step-by-step process of assessing the suicidal risk and addressing them with the right guidance by the expert. So that will really prevent the individual from the forthcoming suicidal attempts too. And screening the high-risk individuals, provide the treatment for the actual suicidal crisis in the hospitals and in the telephone helplines. So we have a lot of telephone helplines. Even we have segregated based on the states. We have a lot of NGOs who run suicidal prevention centers. So when you have a really a suicidal ideations or thoughts, it is encouraged to dial those number. You don't want to explore your identity, you can dial their number and share what is the emotional turmoil that you are facing. When you share them, they will give you a solution. Uh, they will give you a solution, they will direct you from your suicidal ideations and thoughts. And what is your focus on the tertiary prevention? You need to follow up the continuity of the care which is need to be given and strengthen the supportive system, and we have to reduce the residual effects of the suicidal attempts. So this is for these all aspects of focuses on the territory prevention of suicide. And these are the suicide prevention helplines. We have based on all the region based. We can have a south, north, east, west. We have a lot of helpline numbers, the phone numbers, where the individual has a suicidal thoughts or ideation. They can call them. The volunteers are helpful for the 24 hours. Of course, many suicidal prevention centers are been starting up and they are closing up because they don't get volunteers to help out the individuals for the 24 hours basis. But there are existing good suicide prevention centers also there in our country. So when the individual has a suicidal ideation and thoughts, they have to immediately, it is encouraged to call these numbers because they are going to help. Because many who has attempted suicide, when we address them later, they think that it's a wrong thing I have done in my life. I have done a very wrong thing. Why I should not attempt the suicide? But at that particular time of emotions is really making me or putting me into attempts and in the suicidal attempt. So that is the verbalization we get from the most of the individuals. Instead of doing that, they can dial these numbers, so they are the right persons to help them to come out of these suicidal ideations. That we do individual who is doing suicidal attempts or they completed suicide. Is it correct? Because the individual will think that it's my right to end up my life. It's my life, so I can end up my life. But no, it's legally it is wrong. Okay, the suicidal attempts or completed suicides or it is punishable. Okay, right? So he, even whomever who was provoking the suicidal ideation of others is also punishable, right? So anyone who survives an attempted suicide can be booked under the section 309 Indian Penal Code, which deals with the attempt to commit suicide. The section states that whomever attempts to commit a suicide and does any act towards the commission of suicide of such offense shall be punished with the simple imprisonment for a term which may extend to 1 year, or the individual may affect the individual with put on the fine or with both the fine and imprisonment. Okay, so the suicidal attempts are legally punishable. So what are the protective factors? Still now we discussed about the risk factors, what really are causing us to suicide. But there are some factors which really protect us from the suicidal attempts, which is nothing but the factors which is responsible for decreasing the suicidal crisis, or when the individual has a strong family and social support, easy access to the clinical intervention, have good problem solving skills, and have a conflict resolution person, then a restricted access to the lethal means of suicide, who have a strong support from the healthcare professionals, and when the individual whose cultural and religious beliefs discourages the suicide. So these are some protective factors also. When there is a protective factors, when they have a family support, when they are committed, when the individual have children, when they are socially responsible, right? So these are all the protective factors will protect the individuals from the suicidal attempts. So the nurse plays an important role in management of attempted suicide. See, we are focused on the prevention, but suppose if individual attempted suicide once, the individual may attempt again. So nurses plays a very vital role in managing the attempted suicide. So the nurse need to maintain a good rapport, that interpersonal relationship, because then the patient or the individual will ventilate what is the problem is really causing them emotional turmoil. Secondly, the ward should have a sufficient number of staff to monitor the patients who are at the suicidal risk. Then the nurse has to encourage the patient to express his or her plans of suicide, and encourage the patient to develop the socialization. Talk to others, ventilate to the others. The depressive ideas will reduce them into half. Okay, when we keep sharing, our depression will come down, and our happiness will get doubles. So that is the concept that we encourage socialization in patients. The nurse needs to record about the behaviors or the behavioral changes which is being seen in the patients. The nurse can involve the patient in the group games in order to relax and divert from the suicidal ideation. Of course, it's a temporary measure, but it is required of those small gratification which also helpful from the suicidal attempts. The nurse can encourage them to involve in the spirituality, relaxation exercise, watching TV, etc. And the nurse has to provide the appropriate counseling. If the patient has attempted suicide, then immediately it has to be informed to the psychiatrist, and then the life-saving measures has to be started up to preserve the patient's life. If the patient is dead, suppose we fails, we need to inform the police and proceed with the legal actions too. So as in the initial slides, I said that the suicide was going to be a very, very, very booming issues among college students. So why? What is the reason for it? Because among the college students, the mood disorders are the one of the most prevalent mental health problem nowadays, because majority are having anxiety and depression. Okay, the most prominent is anxiety and depression. And according to the experts, they say that highly detailed suicidal ideation is also a symptom of a mental health disorder. Furthermore, there are eating disorders, alcohol, or drug addiction among college students is also prevailing nowadays. If these mental health problems are not addressed promptly, then they can have a severe impact in the quality of life. Is this the anxiety and depression is linked towards the college, and why these suicidal attempts are very booming nowadays? Because the statistics indicates the school or a college related stress is one of the significant drivers of the mental disorders. Going to college pushes the students outside their comfort zone, from the financial worries to the pressure to the succeed academically and find them a good job after graduation. It's all going to be the normal level of stress. Use stress we all come across, but that becomes a distress now. The use stress becomes a distress now. So that is a very major issues in college students. The immense stress is again leads to a depression. If not treated, again it affects the quality of life. So the recent studies also states 1 in 5 college students suffer with the recurrent feeling of self-loathing and immense sadness. It may result in an unhealthy amount of stress and anxiety. It may failing to fit into the groups and not making friends. So, the individual is not a part of socialization. The college students compare themselves with the others on the basis of their looks and physical appearance, but they compare the social status and materialistic possession as well. See, this comparison is a very, very, very major issue among them. When they start to compare, then automatically their inferiority complex develops. When they look up the person in terms of good physical appearance or in terms of higher social economic status, so this comparison becomes them put them into a lot of emotional turmoil. So this has to be stopped, and there should be a proper moral classes has to be conducted on regular basis on college students, where the focus has to be stop comparison. Do not compare. So that should be the main focus to the teaching has to be given among the college students. The feelings of depression may intensify and leads to the suicidal thoughts. So why the students have more perceived stress? Because see, stress is also mainly focused on the perception of the event, right? So one can perceive a stress is very minimal. It's nothing. When you perceive it is going to be the very huge mass which is going to harm you in future, then it's a big thing. So it's all depends upon how you perceive, right? So the students are perceiving there is a rigorous college curriculum and constant worry about the career choices, whether I need to choose this or that, what it is. They are not happy and they are not satisfied with the college life. So they are even the brightest students was turns them into a dull student. And there are a lot of psychosomatic. It affects the physically and make them to lose their appetite, and even they're not sleeping properly. It also affects their sleep cycle. And students may show they on the food. That a lot of students, when you take up the obesity, there many are obese. When we address them why they are suffering from obesity, it is not only because of their hereditary. This is because of they become emotional eaters. They're eating too much because they are stressed. They are eating too much. They show them they are stressed on the food. Okay, so that's a very booming issue, and that has to be addressed among the college students. So I already said, unless we treat the root cause, there is no solution for the suicidal prevention. Okay, so we need to treat the root cause, and one of the blooming issue is electronic gadgets addiction, or social media addiction, video game addiction, and addiction to the nicotine and alcohol. We come across in the news the person who is addicted towards an online rummy game. He lost all his money and he's attempting suicide. The individual is drinking too much and having the nicotine abuse or an alcohol abuse, and they have end up their life. So the individual who has we can be able to get the new hear the news like the individual is addicted towards the social media, addicted towards the cell phone. A child was attempted suicide because of mother was not buying and giving me a cell phone. You get these. This is all the sign of addictive behavior. Okay, unless we address these addiction, we cannot prevent the suicide. So it is very important to address this addiction, and the proper guidance and counseling measures is necessary. And how come we can detoxify this addiction? With some simple step: realize the individual is addicted. Okay, realize the person is addicted. When the individual is using more number of times and spending a lot of hours in gadgets, then it is a sign the individual is addicted. Even the individual has a very important task and works. The individual is spending a lot of time in browsing. It denotes the individual is having an social media addiction. So first understand and realize the individual is addicted. Then only you can go to the solution. and lay some basic ground rules. You create your ground rules, like these many hours only, it is the required time I have to spend in the social media, not more than that, because that really cause you psychological issues. And start a small steps to come out of addiction. It may be any addiction, and self monitor yourself about your addiction level, follow it correctly, and if necessary, when you are feel that it is out of your control, then it is the time that you have to seek the mental health expert help. The very major issue is going to be bullying, that is making fun of, putting the other down, or threatening them with another person. This bullying is again causing a lot of psychological trauma in the students. And this bullying was turned into a cyberbullying because it's we have an emotional blackmail for when you have a cyberbullying, when you have a touch up with the social medias nowadays. So to prevent them from the cyberbullying, first you need to educate yourself, protect all the online password, whatever the password you have, keep changing your password and keep your photos secure. Many are putting up their photos in the social medias, in the Facebook, in the WhatsApp as a profile picture and all. Remember that your photos are not secure, so keep your photos secure and locked every time, and never open the unidentified and unsolicited messages. Like there are some messages that you may reach, you may get it in WhatsApp, or you may get it in your SMS. When you open it your entire phone is going to be hacked. Okay, then you will get into as a victim of cyberbullying, right? You will get a lot of blackmails in regard to that. So never ever open it out, right? And log out all the online accounts. We will log in, but we forget to log out because we feel that it is going to be it's my laptop, it's my phone, so why I want to log out, right? But you have to think that anyone can access your mobiles and your laptops when you are touching up any sort of suspicious link, then automatically the hackers will take all your accounts, right? So pass before you post, right? When you want to post something in the social media, think, is it really required? Because nowadays when you want to follow up what the individual is doing, you can address them in the WhatsApp status, because when you see the WhatsApp status, you can able to see, because A to Z they are updating, right? That gives us that the person also has to think that it is a monitoring for the person whom I know and who I didn't know also. Their person is monitoring me, right? So always think before you post, and raise the awareness, have a proper privacy control, and Google yourself so that you can learn many things, and don't be your cyberbully of yourself first. So we do, as a psychiatric nurse, we do a lot of prevention measures. We do psychoeducation, awareness, counseling, and information education, communication to prevent any sort of mental illness, to prevent the suicide. And we do mental health promotional activities also, like we assess the patient using a detailed history, mental status assessment, and do a special rating scales and many mental health status assessment also. And we provide the special therapies such as relaxation therapies, yoga, and psychodrama. And if the patient recovers, if they are going to be depressed and severely, then antidepressants is going to be a choice. Okay, giving them a guidance and counseling is not going to help them out, because the individual who come out of from the severe depression, when they turn towards the state of a mild depression or higher in terms of the attempting suicide, so administer the psychotropic agents are going to really helpful when the individual comes under the category of severe. And we do take care the patients starts from the basic hygienic measure. We monitor them regularly. We need to have blood samples taken up to monitor their drug therapeutic values, and we need to address also and monitor the extrapyramidal symptoms, because when you start up with any sort of psychiatric medications, there are a lot of side effects and extrapyramidal symptoms. Again, that will also harm the individual, so we need to address them. And we also perform the suicidal risk determination and check out their ideation. So it is all the general care that what we as a psychiatric nurse we provide to the patients. And it's very important to handle the patient's hallucinations and delusions, because the individual who was attempting the suicide, it is because of the command hallucination. The individual get the commands that you end up your life, you do suicide, and automatically that command hallucination is going to be the root cause. So the patient has to be address what the voice is saying, what the voice is really saying you, and how many times the voice is will say you, will address you. Those details has to be collected. The history has to be collected in depth, and appropriate antipsychotics has to be provided, administered to the patients. And the restraints has to be done if the individual is harm to self, if the individual is uncontrolled by the counseling, then we have to protect the patients. And we need to administer the psychotropic drugs, administer the counseling, psychoeducation, relaxation therapies as per the routine. We need to have a proper therapeutic communication with the patients as well as the health team members, and we need to focus on the psychosocial rehabilitation measures. So overall, when we help out in all the aspects, which will help out the holistic improvements in patients. So what is the take-home message to prevent the suicide? The students or the individuals, okay, are recommended to keep sharing always with the right person. Identify the right person and keep sharing. Okay, so when you are keep sharing, your emotions, your negative depressive ideas will come down. When you share your happiness will get doubles. So always identify the right person, a genuine person, and keep sharing your things, because that keep you emotionally, that keep you psychologically well. And always have a positive outlook with the right perception. Okay, because stress always depends on your perception. Have a positive outlook, don't have any pessimistic view in any aspect of your life. Always have a positive outlook, and unnecessarily we don't want to worry, right? Right. So that's the thing. That's a quote was said: when you have a problem, okay, you have a solution, then why you want to worry? When you have a problem, you does not have a solution, then why you want to worry, right? Anyway, worrying is does not give any sort of solutions to any problems, right? So do not worry. That keeps the individual to be stressed, depressed. Okay, so do not worry, and don't compare yourself with anyone, because you are the best in anything what you do. You are the best, so do not compare you with anyone else. And have a right problem solving approach. When you have a problem, we have a solution for the problem. No problem is there in the world without a solution. That is the solution. So have a right problem solving approach, how we can approach the problem, how we can solve the problem. Be jovial always. Okay, so Mahatma, the respectable Mahatma Gandhi, our father of our nation, states that I have been attempted suicide a very back if I does not have the jovial thing within me, the sense of humor within me, right? So this is the quote was given by Mahatma Gandhi. All right, so we have to crack jokes, we have to be jovial, right? Because the jovial things will makes our stress to come down. And follow the proper relaxation techniques. We saying the relaxation techniques, exercise, we talk, but the person who does that on a regular basis will have a good psychological health, that will really help them to come out of stress. So have a regular yoga and meditation in your lifestyle, and healthy diet. Have a good quality sleep. Okay, because when you have less sleep, then you are depressed. So have a good quality sleep, and quit smoking and alcoholism. And at last, the very important thing is to address is we need to develop a high frustration tolerance, because that is lacking in the person who are attempting suicide. Okay, so when you have a frustration, okay, we need to tolerate it. We need to tolerate it, and we have to think and have a proper problem solving approach. So that is a very vital aspect that the individual has to develop in their lifestyle. So for the further reading, this is a textbook of psychiatric nursing I have written. It's based on the syllabus of Indian Nursing Council. So you can refer, get the more notes and the more information from the textbook. So it's available online in Flipkart and Amazon. Right. So you can note down my email ID. If you have any further queries, you can very well approach me through the email. And at last, let us join together. Let us have our support to promote the positive mental health, so that we can come out of suicide very easily. Thank you. And
Thank you so much, Vikas sir. So, uh, with your guidance, we got to know how to chalk out a plan and how to care for a patient. But on the overall, I got to know that a nurse has to be a very good listener. If she is not a good listener, she cannot understand any problem of the nurses, any problem of the patient. So she has to be a good listener, not only for the patients, but at the home ground also, at the family level also. The good parenting leads to a healthy person. And I think, and I want to add to it, that if we are doing the right parenting, that will lead us to a healthy person which we can give to the society. So it starts with that. And as you say, problem solving skills and strong family, so both start with the nurse at the home ground itself. So thank you so much, sir, for giving us this opportunity to be with you and talking about the plan for preventing and policy making for the suicidal prevention. So, moving on further, I'll hand over the mic to Medvin, sir. Please, sir. Uh, Hello,
Yeah, I could hear.
sir. Can you hear it?
Yeah, yes, ma'am.
Okay, sir. Over to you, sir.
Yeah, thank you, madam, and thank you all the presenters. Before getting to next presentation, I just want to make small announcement. We have sent attendance link in the chat box. So all the participant, I requesting you to fill the attendance, because many of them registered participant, and some of them have joined directly with the link. So we need the participant data at least for preparing a participation certificate. So kindly do fill the Google form which been sent in the chat box. So you can find the Google link. That is one announcement. The second announcement, there is a small short survey we are conducting regards to the suicidal thought among nurses, because there are a lot of stress. We are also coming up, I mean, overcome the day by day in work area, in family, obviously cooperating, I mean, sorry, cope up with those scenarios in day-to-day life. It's really a tough job, however, we are coming up with every day. But just we wanted to see how far the nurse is having the kind of suicidal thought. It's a very short survey. It has a couple of questions, maybe 3 or 4 questions. It's purely voluntary basis. You can will post those links in the chat box. Uh, so none of your personal details will be asked, and it's purely voluntary basis. If you want to participate in that, kindly do click the link and participate. That is the second announcement. And thank you all for the patient listening, and we'll continue with the next session. Anurika, you can uh, take a charge and introduce the next speaker.
Thank you so much, Melvin, sir.
Yes.
And as we have chalk out our plan on policy prevention of suicidal, now we'll go on to making actions we have done and learned all that to chalk out the plan to prevent it. Now we'll coming on to actions. Strong and the speaker for that is Gracie as Jabestina. Ma'am, we welcome you and to highlight her credentials. Um, she is a senior psychologist at Sukrat. She holds a postgraduate degree in psychological counseling from Christ University, Bangalore. Her area of expertise lies in family and marital therapy. Her interest includes group therapy, life skills, training the trainers, and delivering life skills sessions to various groups. She also provides therapy to the adolescents with behavioral, emotional, and interpersonal issues by using an eclectic approach focusing on cognitive behavior therapy and behavior therapy. She is also director Unleash School LLP, and affiliated that works with education system and is closely involved with Parikarma Humanity Foundation at their Educational Transformation Center Committee to sensitize government teachers and to empower. We all got to know that main things which we have covered in the beforehand, what we have learned from global magnitude suicidal tendency by Mr. Nicholas, that most of the issues she'll be covering and she has an expertise on. Please, ma'am, we welcome you and handing over the mic to you. Gracie, ma'am.
Thank you. Thank you so much. Am I audible? Am I audible?
Yes, ma'am, very
Okay.
much.
Yeah. Thank you so much. Um, you have all discussed so many things about prevention of suicide, and I also heard the last speaker talking about the science of suicide. But let me tell you that I wasn't, I'm sorry for not being able to be there for the entire program. Um, so I will not, pardon me for the flow of things that I was not able to take you, will be taking you through. But let me tell you that I'm going to bring the practical essence of how each one of us as individuals and responsible members of various organizations and community, what we can do to prevent suicide. So let me just present my PPT. Kindly let me know, is this visible
No, ma'am.
right now?
No, ma'am.
No? Okay. Now is it visible? My screen, entire screen?
No, ma'am. Yeah.
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 Thank you.
Can hide that tagline, ma'am, from bottom.
Right now?
Yeah, yes, ma'am. Yes.
Okay, great. It's visible, right?
Yes, ma'am. Yes.
Yeah, okay, then go ahead. So, suicide as a cry for help. I think we need to take these words separately and see it as well. Cry, when do we cry? When we are sad, right? So, sadness a prolonged, I heard Dr. Prakash talking about it, that, prolonged sadness leads to depression, and there are various stages of depression: low, high, moderate, um, very severe. So many a times it's always, you know, cry for help, which we are not able to identify or help individuals. That's when they push themselves to suicide. And they are not being able to help themselves also. So please understand, as humans, we all have potential to do something when um, we are pushed into difficult situations. But when the moment this sadness overtakes us and we are not able to take help, at that moment we are not able to or I cannot think of ways that I can solve an issue or reach out to someone who can help me. I think that's very critical. So cry for help is the definition of suicide in very simple words. um, and it's and many times this is missed out. um, as you have heard a lot of things that was discussed about the last presenter. Um, it's people just, or individuals, sometimes we ourselves, we will not be able to assess. So when we are moving, it's a very thin line from sadness to depression, right? Because it's a prolonged one. It takes time, and it's lot of unexpressed anger and unexpressed emotions that gets built up in one individual so much that one day it's not ready to handle anymore, right? So it's so difficult to express for the individual, and for the others to find out these things is a little difficult, as only when we are very attentive to the behaviors of the individual who is trying or planning or contemplating on suicide, um, you will not be able to identify. So let me take you through us. I think many things have been discussed by the last presenter, but let me put you this, give you this abbreviation to just keep you remember easily, that whenever you come across an individual and you sense that you need to do a quick assessment on how they are feeling, are they at the risk of suicide, you can remember this: is path warm? Okay, so I'll take you through each one of you, or each one of the sub things. Is ideation. Now ideation are thoughts. um, I would like to show you the triangle. Action is the tip of the triangle. And if you see the other ends of the triangle below it, it is thought and the feel. Now, sadness and the thought that I am worthless, I don't have anyone in life, these are the thought becomes very, very important, which pushes us to take action. So, being able to identify what are the thoughts this person is having. So, behaviors, observable behaviors helps us to understand the thoughts of what the person is feeling. For example, there was this student who I met years back, was extremely happy, and teacher noticed that the student is extremely unusually happy, and we checked on her behavior. And while the teacher asked a lot of questions, she said, I'm happy for everything because this is my last week of my life. So after that, the student was referred to a counselor who further investigated to understand that the thought behind that was she had a suicidal plan already set in, right? So we need to be able to help or identify the thoughts that are behind the person, why this person is doing this way. If we are able to assess that ideation, we'll be able to help them. And the other thing, substance use. There might be, I'm using the word substance use because there might be excessive use of substance. It can be alcohol, it can be smoking, it can be any other drugs, where they are being stressful and been using it, and off lately it has really increased high, right? So noticing the increase in the usage of the substance is also something that we need to note down. And let me move to path, purposelessness. So you might hear individuals saying, "I don't know why I, you know, was born," or "I don't know what's life for me, what is ahead of me. I don't." So when they are not able to see through what's going to happen for them and have a purpose or a meaning in life, when there's no meaning left in their life, we need to be alert. And anxiety, post-traumatic stress disorders, or various other anxiety disorders that can also be one of the reasons that, if you find anybody very anxious, you need to understand that there's something that more deeper has to be done with this individual. So asking, we get into those things. So it's a sign of that they are having suicidal ideation or thought. And the next is T, trapped. Now, when you say trapped, it's a feeling that there's no way. They are in a bubble, thinking that I will not be able to come out of this at all. And you can see that in their actions and their words, in their communication, by saying they will, you can say, they will say sentences like this, I feel that I can't find out way out of this, or I don't know what to do, I'm stuck. These are some of the statements that people use when they feel very trapped. And let me move to the next letter, H, hopelessness. And the feeling of hopelessness can be for oneself, that I can't do anything, I don't know anything. um, it can also be for others. If, it can be my family is not able to do this, or my as a teacher I'm not able to do this, as a, to my friend this is happening and I'm not able to do this. It can be for the for others, and it can also be general, um, about the future. No hope at all about anything in life. So hopelessness can be seen that way as well. And let me move to warm, W, withdrawal. So when I say withdrawal, it is isolating themselves from their friends, families, and their usual activities, which can be, sports, or engaging in a hobby, or visiting people, all or and also engaging with things that they really love to do. So withdrawal from all these things can also be a sign of suicide. And many times, um, it can physical withdrawal can be easily seen and observed, but psychological withdrawal we need to be observant of. When I say psychological withdrawal, they are with friends but they don't engage with friends. They're just there. They are uh, thought in their, they are constantly caught in the world of their own thoughts, and they do not engage with the others. So many a times, especially adolescents and children and young adults, you would see that they They are with their peers or with their friends, but they are withdrawn. And let me move to anger. A unexpressed anger. It can be for small things to bigger things, which are not being expressed but very suppressed, and not been able to express with anybody. Therefore, they are very angry, and the only thing that they know is to take out on themselves, and that is one of the greatest signs of suicide. And let me move to the next word, restlessness. Um, Here, they are not being able to think about what is the consequence of doing certain things. So they can be very reactive. That's when they do not think of what will happen to me if my life is gone. They will not be able to even think of it. For you and I, who are not depressed, will be able to think about how, okay, if I'm late to a class, I know I'm going to get a scolding, and or the teacher will just let me in. There are so many options available, and I know I can tell 2 3 lies, or I will say sorry, I'm late, and I walk in. There are a lot of options available, but with a depressed person, they feel that they can't do anything, and they will not be able to think of, okay, what is going to happen next, because the critical ability gets numbed, right? And mood changes is the next word. Dramatic changes in the moods. Uh, Sometimes it can be very unstable also, with especially with severe depression to moderate depression. So being able to observe the mood changes can help us to identify that they are having signs of suicide, right? And so, knowing the signs of suicide, what we can do as individuals. Uh, Again, I'm going to give you 3 words: ask, care, and escort. Now, you will have a question that, can I ask a person, are you thinking about suicide? Yes, definitely you can ask. Because many times we feel that, no, am I putting the thought into that person by asking the question? But it is not. It is okay to ask that, are you having any thoughts of killing yourself, or have you thought of dying? What is your opinion about death? Are you thinking about it? There are different ways that one can ask, but please understand, it's a myth to say that if um, I ask someone about, are you thinking about suicide? You are not putting a thought on that person. In fact, you are opening a very difficult conversation where the person will be able to engage with that, right? So, so it's okay to ask, are you thinking about suicide? And actively listen. Now, when you are actively listening, you listen completely. You are with that person, just being there with the person. Whatever the person is saying, just listen. There are many times, it can be even through phone calls, that people would get in touch with you, and when you are talking, you realize that they are having suicidal ideation. Listen, listen actively, very, very much. Because the person who is going through depression needs a lot of comfort, where the other person will be just listening without judging, without bringing their opinions or views about whatever you are thinking. So, listening is one of the very, very important skill that we can exhibit at that moment. And as you are listening, acknowledge their talk, feelings, and their behaviors. Acknowledge, yes, you're going through. I know it must be too much. Yeah, it must be frustrating. How are you feeling? please encourage them to share their story a little more, because understand that this person is struggling to tell. And if you are opening up the conversation for them and telling, and by asking them, what is that is one thing which is troubling you the most right now, you know, that will help them to bring a lot more conversation. So keep your questions simple but open, so that you can avoid the closed questions like, are you feeling down? Yes, no. Avoid those questions, but keep questions which are very open, where you just, you know, talk to them on, ask them very specific questions saying, can you share a little more about how you're feeling now? How lately from how long you have been feeling this? You know, if you've been able to engage with them for a long period of time, that's going to help the person a little more. So ask. The more you the more you are asking facilitative questions, which helps them to share their story, because they have bottled up many things. It's going to easily going to, you know, explore out. So ask. At the same time, let me also tell you, do not ask a lot of questions as if you're very curious about it, because that can also irritate the other person and say, oh, you will not understand me. You are interested about knowing things about me. So the intention is to help the person, not to understand why this person is thinking this way, right? Because we bring our judgment into it. So when you are asking, please understand that um, do not say right or wrong things. No, do not discuss whether the feelings is going to be good or bad. Just help them to vent out whatever they have been going through. Yeah. And move on to the next one. Care. Now, I have again put the word listen, because it's very, very important. When you're listening to the other person, they need to sense that you are caring. They need to sense that you are asking them questions because you care them. It's not because you're going to judge them, or it's not because you're going to, you know, make them even more terrible, because the person has been going through so much that he feels nobody can understand. So when you as an individual are showing care, you know, that person is going to open a little more and is going to engage, which is going to uh, allow him to walk towards the path of healing. It begins from oneself. So I have to ask them, I have to listen and be with them completely. Now, care about the issues and troubles. Now, when I say care about the issues, it's like, for me, let me give you an example. For me, um, daily chores of my something that I do in my kitchen might be very easy for me. But for a person who is depressed and who has been managing too many things at home and at work, he would say that, I'm not able to cook also. It's so difficult. If the person is sharing, can we show a care about the issue? Can we keep aside our judgments and be able to listen and say, okay, how difficult it is? If you're asking how difficult it is, the person is going to explain a little more. But instead of if you're saying, oh, it's just cooking, you can order on Swiggy, it's not going to help, right? So care about the issues and the troubles the person is facing. So it has to be sensed by the other person. Only then they will be able to open a little more, and whatever they have been holding will just release slowly until they are completely healed. So as the um, first aid, or the person who you are assessing, you can lead them to the path of healing at the first point. Here, they need to sense care. Yeah. Let me move to escort. Now, it's very important to escort these individuals because they feel that nobody cares, nobody understands me, nobody, if even if I die, nobody cares for me. What's the big deal if I live? These are the questions that they already have in their mind. So, being with them, completely being them, physically being with them, even if it is a call, being with them till you find someone who can help them physically is very important because we cannot leave them alone at initial the moment when you got to know that the person is having suicidal thoughts. You cannot leave them alone. Please ensure that you are with them throughout and till you transfer to because when we refer to someone, we just say this person is being referred to this person. We need to transfer because it's really important to share few data and also the intensity of the suicidal um, plan or ideation or whatever they are having, we need to transfer them so that those informations are helpful for that person and the other person who can help them can also be able to easily help them. So escorting them, being with them is very, very important. No matter what they say, don't worry, I will be okay. You can go now. We cannot leave them. We have to be with them, right? And before I move on to my next slide, I would like to open you all to the. Um, do you have any questions or anything that we can take it up right now? Or are you with me till now? Is there any questions that you want to ask? Because initial stages, immediately once you know that this person is having suicidal ideations, you will have to tell this. Is there any questions or anything that, any thoughts that you want to share right now?
We
Or you
have
can
given
all,
access to all the participants so they can talk. Actually, they can unmute and talk if
okay,
they have
great.
any queries. We can discuss with them.
Okay, great. Okay, it looks like no one wants to ask a question or share your thought. If that is the case, let me move on and I'll open again after I finish my presentation. Yeah, is that okay? So let me go back to the PPT. We were talking about others, but it's also important for us to assess our own mental health. Many times, as healthcare professionals, uh, we easily ask, "How are you doing? How was your day?" for the other person, but it's so difficult to ask ourselves. So these are some of the questions that I have put in front of you, which I would like you all to answer for yourself. How would you describe the mood overall? Answer these questions to yourself. Has my mood changed at all over the last 6 months to a year? And if it is changed, why it has changed? And what was the reason behind that change? Has my level of stress or anxiety changed recently? And if it is stressful, what is the level of stress and what are the stressors that has created a lot of anxiety in me? What strategies do I use to manage a low mood or an anxiety when they come up? What do I do when I'm anxious? I do certain things. Are these strategies working for me? Are these strategies healthy? Is it healthy or not healthy? I will move on to the next set of questions. How am I functioning at work? Is there any significant differences that I see in the way that I work? How am I functioning within my family and in social relationships, friendships, with close family, with extended family, with well wishers? How am I functioning? Do I find pleasure in things that I have usually found pleasurable? It can be your hobbies, your interests that you have. Has anything about my mental status changed? Am I having problems with memory, reality, testing, and confusion or concentration? Have I had any thoughts of wanting to hurt or kill myself or someone else in the last few months? I think these are some of the questions that we can keep as reflective questions to, um, sense our own mental health. Where I am in, you know, um, mental status right now today. Because it's easy for us to ask to others. Can we also ask ourselves and to some of our close ones often and keep that questions very open so that these questions are very naturally part of us, and whoever we come across, when we sense them, can we ask to them? Because once as an exercise I'm able to do it for myself, it's going to be very easy for me to talk to the others. So as healthcare professionals, we take care of all the others' health, but do we take care of our own health? Healthy body makes healthy mind, and healthy lifestyle, healthy relationships leads us to have a healthy life. So this word healthy, is it just for the others or for us as well? And one of the important aspects that I wanted to highlight is, can we practice healthy thinking? Can we look into issues that we are facing, challenges that we are seeing, accept the failures that we are being facing every day? Can we accept those and say, yeah, it's okay? Can we forgive ourselves for the mistakes that we have done? Because many a times these anger that we are not able to do things is enormous, and which leads to depression as well. So can we practice healthy thinking to be able to accept our own selves and accept the others without being judging, without being critical, without um, shaming the other person? Because it's very natural. It's very natural for us to get into these things as individuals. And reminding you all that, can we connect to bigger things for a bigger purpose? Because the universe has a purpose for each one of us individually. Can we also make bring a difference to others by having a bigger purpose, by doing something, um, and create supportive networks within us, develop some of the skills that we lack, engage in healthy hobbies of can I how I can ask help. I am a doctor, I am a nurse, I am a psychologist. How I can take help? No, we are human. We can take help. So building those supportive, healthy network within ourselves can help us to reach out quickly, easily. So taking help. We need to be resilient. Resilient individuals only can build resilient families. Resilient families can build resilient communities. So can we take initiatives to be there with someone who is going through a lot and say, it's okay, I'm with you. In our day-to-day affairs, because these are the differences that are going to bring a huge change in preventing suicide. Words like, I'm there with you. And nowadays, we see a lot of WhatsApp status where individuals are posting, I'm feeling lonely. I don't know why I'm alive. A lot of things, a lot of questions, existential questions keep coming. And you come across that through WhatsApp statuses. What is your response? Can you, and existential questions as comments from your friends, family members comes across. Do we pay attention to it? Do we respond? It cannot happen unless we make it a practice that to ask everyone saying, hi, how are you? How are you doing? Is there something that I can help you? Because these are the things, if our younger children, if our children, if our adolescents listen, they are going to respond very easily when they are actually in a critical situations. So I'm stopping here by saying that can we take care of ourselves by giving importance to self-care and then extending through our actions, through our words, to all the others who are around us. And it has to be an everyday practice. Otherwise, crisis interventions only will not help. So, thank you so much. I'm open now to any questions or anything that the group can ask or share. You can share your thoughts as well. Have I made you think a lot or feel a lot? You need to help me to understand that because I'm not able to hear anybody.
Sending message. If anybody wants to talk, you can unmute and talk.
Yeah, or you can put it in a chat box as well. Okay. Sure, I'll share the questions. I can share the PPT to the organizers as well. They can also send it to you. Prem, thank you. You can share your thoughts as well.
Ma'am, if nobody is responding, then shall we proceed next, ma'am?
Sure, we can do that,
Yeah.
but I would like to hear from at least one or two of them, if you don't mind. Is that okay?
Yeah, no problem. Participants, kindly, unmute and respond to the madam. At least one or two.
Hi, Gracie, this is Santosh here.
Yeah. Hi, Santosh. I'm long time I'm been able to meet you. How are you?
Yeah, good. Thanks for accepting the short time invitation and sharing the thoughts. The practical thoughts, what you told about this warm path warm and the how day to day, that was very interesting. It will be more impressible if there are case studies. Uh, Case studies could be. I know you are working a lot on this topic. If there are some case studies which are written or which are shared somewhere, if you have on your website or somewhere, resource material could be shared, because as a practicing nurses, there are many practicing nurses or maybe the future nurses in this webinar. It will be very
Sure.
helpful for them to analyze from your end of being practicing. Thank you.
Sure.
I think
Sure.
Professor Prem Kumar is also waiting to give your feedbacks.
Sure.
I'll
Thank
hold
you
my.
so much. I'll keep
Thank,
that in mind. I can also share few. I can share.
thank you.
I will do that. Thanks. Thank you.
Yeah, good afternoon, ma'am. Very nice
Thank,
session. It is a
yeah.
very excellent session. Actually, so many problem it is for healthcare worker also facing, ma'am. But it is
Sure.
not coming out. Okay.
Yes.
So, for example, nurses are in practice side, in hospital side, they are facing colleague politics as well as family problem and everything they are facing. Nurses. One side in teaching side, it is nurses are facing so many problems. Nurses, I am not saying nurses. Nursing profession and other professional healthcare workers also facing so many problems. How can avoid, ma'am, this one? For example, one incident happened. One client came and met me, told him it is a higher official harassment is there. What to do, sir? Like that. I said, what type of harassment you are facing like that? Yes, he told me some sexual harassment like that. That she is a lady. How can we can educate them, ma'am?
Sure. Thank you, Professor Prem, for that question, which is very important because many a times fear is something that stops us from taking action. Right now, you are saying it's a sexual harassment and fear of what will happen to me if I take some action. It's so we need to create spaces like these safe spaces in our own ways in within the organizations that we are, safe spaces where we discuss issues. Even now, I when I said I want to hear few people, because many a times we do not talk about our own uh, um, difficulties. It's very painful. We would say I would keep it for myself. That's when suffering happens and which leads
Yes,
to
absolutely,
depression.
ma'am. You are said
Right.
correct only, ma'am. Exactly, no one speaking. Yeah.
Yes, so we need to create safe spaces. Safe spaces, when I mean, it can be a group of 5 to 6 individuals coming in a group regularly to share what they have been just feeling about work, about how they've been managing work and family. Is there any trouble that they have, and see what they can do about it. So I think um, we need to give space, build spaces where they can voice out their opinion, because if it is individually they are facing, they shy away. But when it comes to safe spaces as a group, the group is going to be there to help them to take action, so they are not alone. It will be like I'm with somebody, is there for me and I'm with someone, right? So that itself gives a bigger resilience for the person to fight out whatever it is. So I think we need to create spaces where people voice out, share their stories. Yeah.
Yeah. Okay, ma'am. Thank you.
Thank you. Thank you. If there are any, not any questions, I think I will hand over it to. I would like to hand over it back to you. I'm sorry I didn't hear your name properly.
Good afternoon,
Sorry.
ma'am.
Thank you.
This is Anurika this side, and thanking you for gracing this webinar with so enriching, enlightening thoughts. And I really appreciate when you said that it's not others' health, it's your health also, our mental health also. We should be at the peace if you want to care properly for the others. Thank you so much, ma'am. Now, I would like to cordially invite Santosh sir to announce the videographic results. Sir, please announce the results.
Hi. Again, I'm here. Announce the results of. It is always Mr. Mallikarjun is one among us who is very active and, let me say, not active, proactive to take initiatives to keep people engaged, including me and Melvin and other Anurika and all. He is one of the uh, main person who initiated this complete to observe the national international suicidal prevention day, and he thought a lot. He invested his lot of thoughts. One of also it was always our intention to ask people to share their thoughts and how do they. One of the way was to organize to do just to give a speech or give just create a video. So last year also we did the same, and this year also we have asked the anyone who is above 18 years to send their self-made videos and without any self-made videos. Let me stop there. And with that, we got a good number of responses, and we also learned from this how to improve how to improve our availability or our accessibility to the larger population. That we also learned this time, last time and this time too. There were entries, and we have all the entries who have submitted the videos are posted on YouTube World Explorer. The links are shared there, and I am going to announce the result. I think it is. I have myself seen the videos. They're amazing. So their creativities are, I can't tell in the words. I request you all to go to the given links and see them, and you can appreciate and you can write. As per the criteria of, there was a criteria to evaluate them. As per the criteria, and there are two external evaluators who have evaluated. I would like to say it's just there was a only 1 point difference between among them. It was very difficult for evaluators to evaluate. So I will just tell which are some of the technicalities which somebody is better. It's everybody's core competency. Everybody is not, but it's not mean that they are not bad, others not good. All the videos which are submitted are excellent, but we have to this grading, which is we have to do because of some monetary support, honorarium. We are not telling it's a prize, just a honorarium to support their work. In that regard, I will the third prize. I'll announcing the third prize goes to C.K. Shakili and team from PES College of Nursing, Kuppam, Andhra Pradesh. Congratulations to you. The second prize goes to Sridhar Raut and team from Symbiosis College of Nursing, Pune, Maharashtra. And the first prize goes to Mehak and team, AMT uh, school, government school, GMCH Jammu. I congratulate all the participants who participated and all those uh, who got this honorarium to do that. Thanks for your participation, and we hope you will engage more with us in the future too. Thank you. Over to you, Anurika.
Thank you, sir. Congratulations, everybody who has got the videographic results just now. And now I would like to hand over everything to Melvin, sir, who has given me the opportunity to be here and conduct this webinar. And I will request him to show the videos and deliver the thanks note. Thank you, everybody.
Uh, Thank you, Ms.Anurika, for doing Master of Ceremonies for this entire session. It's really, helpful for me to organize this entire webinar. And I wish all the winners, congratulate all the winners, and will take some couple of minutes to project those videos here. And really, the students have worked a lot behind to come up with those videos. Let me project those videos. Then after that, we'll go with the vote of thanks.
Creating Hope Through Action, presented by GNM First Year Batch 2021-22 from Government AMT School, GMC at Bakshinagar, Jammu.
काश इस दुनिया में मुझे भी कोई समझने वाला होता। क्यों भगवान, क्यों मेरे पास कोई नहीं है, क्यों कोई मेरे पास समझने वाला नहीं है, क्यों मेरे माँ बाप मुझे नहीं समझते, क्यों मेरे टीचर्स मेरे साथ ऐसा बिहेव करते हैं, क्या मेरे में कोई कमी है क्या?
और ऐसे ही ये कहानी शुरू होती है।
एक प्यारी भोली सी लड़की एक छोटे से गांव से आई हुई अपने सपने पूरे करने के लिए, पर उसके सपनों की कोई कदर ना करते हुए वो एक बड़े स्ट्रेस में चली जाती है।
आज महक का पेपर है।
Okay, considering the time, we decided, stopping the video here, and then chat box we have shared the links. The playlist contain all the videos. Kindly, we highly encourage you to watch those videos and efforts of students. And it's time to say a word of thanks. I cannot say, it's not going to end with this session. Continuously, we'll have we'll have a collaborated events like that. We'll have a lot more things to do in the field of nursing. And whenever we find any new topics to be discussed among the nurses, we'll have kind of united sessions so that we'll have a, discussions among us. Fine. So, however, I'll take this opportunity to thank Lord Almighty for giving us, the time and made all the availability of internet connection, technical, all, went well. I would like to thank the Lord Almighty, first of all. Then I extend my thanks to Mr. Santosh, research coordinator for IAPH, who is the sole and whole pillar for entire event. And I extend, sir, thank you, sir. I extend my thanks to Binu, sir, and Binu, sir, also, supporting us since the beginning, and he has given a lot of advices, on all these stuffs. In spite of his busy schedule, he also participated, and Sarah is having another meeting to participate. I thank you, sir, in his absence here right now. And I extend thanks to all the presenters. Mr. Nicholas, assistant professor, was given us a lot of information regards to statistics, and Dr. Prakash sir, and he's in Saudi. There are time bound also, and then even though he joined us and given us a lot of information regards to nurses role and policy aspect. Thank you so much, sir. And thanks to Gracie, psychologist, and even last minute only we informed her. I think she's the last speakers who confirmed, because other two speakers we informed regards this event before, but Ms. Gracie has took a lot of effort to present. Even madam also had morning another session she completed and joined later. Thank you so much, madam, and given a lot of practical related things regards to suicide prevention. And I extend thanks to Mr. Mallikarjun. He is the person who motivated me first to conduct such kind of event, and even we discussed a lot even yesterday night until 12 o'clock. Even with Santosh sir, we were talking about this today's sessions. And I would like to extend thanks to Anurika, who hosted this event since beginning till last, in spite of having duty. Actually, she's supposed to do it today, but unfortunately got to go duty also. In spite of that, she done. It's really appreciable. Last but not the least, I congratulate and I thank all the participants who spent their valuable times and gained the knowledge. I hope you all gain the knowledge and lot of information regards to suicide prevention. Let us unite together. Let us stand together and do action to prevent suicide. I thank each and everyone who attended this webinar, and I thank everyone who helped us directly and indirectly to conduct this webinar. Thank you so much. Thank you all. With this, we'll end this session, and all the participants will receive your certificate by today evening, late evening, or otherwise tomorrow morning. Since it is a weekend, a lot of commitments will be there for everybody. So we'll try to share